Hi, my name's Annie and I am a Senior Human Rights Officer at the British Institute of Human Rights. But before I came to work here, I was practicing as a social worker and I am still registered as a social worker now. Social work is all about trying to improve people's lives by helping with all sorts of social and interpersonal issues and trying to promote people's well-being and their human rights. And we can work in a range of situations with children, families, with adults. So I worked with adults. So I first worked in a community mental health team, and that involved working alongside people who were experiencing mental distress to try and support them with their recovery and help them to live a life that they enjoy. And I was part of a team of mental health professionals, including people like doctors, psychologists, support workers. And then after that, I moved to a Mental Capacity Act team, which was quite different, and I trained there to be a best interest assessor. And my job there involved visiting people in hospitals or care homes where they were supervised to some degree, and they would be stopped from leaving if they wanted to. So I went to see them to find out if they could make a decision, they could consent to living and getting care in those places. If somebody wasn't able to make that decision because of a cognitive impairment of some kind, then I had to look at all the different options, find out the person's views, find out the views of their loved ones, the views of staff that were working with them, and work out if the situation was right for them and it was the least restrictive option. And in that role in the mental capacity team, I also worked to support staff across the local authority and delivered training on the Mental Capacity Act as well. As a Senior Human Rights Officer at BIHR, my job mainly involves designing and delivering a range of learning programmes to help people to understand and to use the Human Rights Act really practically for positive change in their lives and in their work. This can be really varied, so it might be running a leadership programme with staff who work in an NHS trust, helping them to embed human rights legal duties in how they make their decisions that affect people who are accessing the services that they deliver. It could also be co-designing a practical resource for a charity to help them to use the Human Rights Act when they're advocating for their communities, or it could be a standalone workshop with carers giving tips on how they can know and speak up for their rights and the rights of their loved ones. The Human Rights Act comes up all the time in social work. So the best interest assessor role that I was doing exists precisely because of the right to liberty, which is Article 5 of the Human Rights Act. And that's about recognising that somebody's movement is being restricted to such a degree that there need to be some checks to make sure if that's the right thing for them and that there's no less restrictive options and that they can legally challenge that decision if they don't agree with it. The right to liberty came up a lot when I was working in the community mental health team as well, because sometimes I was working with people who might have been detained in hospital under the Mental Health Act because they were in crisis, and to try and help with their recovery. But this also brings up a lot of other human rights considerations as well, like their right to family life or their right to be free from inhuman and degrading treatment, their right to life as well. So in both teams, a lot of my job as a social worker was about helping people to make decisions about their lives and supporting their well-being, both of which are protected by the right to respect for private and family life, which is Article 8 of the Human Rights Act. I have found my social work background to be really helpful in my job at BIHR, partly because I now train a lot of social workers and other practitioners who work all across health and social care services in the Human Rights Act. And I think that having this practice experience means that I can understand some of the challenges of trying to embed a human rights-based approach. I know that there's a maze of different laws and policies that practitioners have to navigate, and I've got examples that I can draw on to show that the Human Rights Act can help to guide decision making through all of that. Also at BIHR, there's such an emphasis on co-production across a lot of our work, whether that's delivering upskilling workshops with people who are accessing a service so that they can know their rights and also contribute to how we support staff to understand their duties, or co-delivering workshops with lived experience experts. I think the core aspects of social work, some of those skills around empathy, transparency and respect really help to guide my approach in BIHR's co-production work. I really like BIHR's approach of providing accessible, practical information about the Human Rights Act and breaking down complex law into something that is easy to understand and easy to use, and then using that to sort of empower people to have their say over some of the maybe big picture changes that are happening that might affect their lives or how they do their jobs. And I wish that I had had some of BIHR's resources, I think, back when I was a social worker, and could have shared some of that practical information with people that I was working with, because I think having that clear information to hand could have helped people to speak up for their rights in those conversations with public services, but also to have their say on some of maybe the local or national policy decisions that might be affecting them, bringing back that message of knowledge is power. My advice to social workers would be to translate the core values of human rights about kind of dignity, respect, fairness, that are so central to social work. Translate those values of human rights into something really practical by getting to know the Human Rights Act and how it works. So it might be understanding the legal duties that it puts on all public authorities, including social workers, so that they can use it to frame their own decisions, as well as maybe to question where that might not be happening with other services, and to understand the 16 rights in the Human Rights Act and how they all work together and how they can be used to guide the complex decisions that social workers are making every day.